We are interviewing Dr. Milton Hammerly. Now he goes by Win. Welcome, Win. How are you?
Great.
Good to see you. I
Good to
want
see
to
you too.
introduce you, and I hope I'm giving you a great introduction. He's got a long resume, so we're going to keep it short and sweet. He's Chief Medical Officer of QualChoice Health Insurance, and he's been taking care of patients from ranging from 40 to 150,000 lives, which is amazing. And in addition to having multiple leadership roles in the past, he's got an additional degree, which I found to be very unique, in negotiations and dispute resolution. Again, welcome, Win, and thank you so much. I've had the chance to speak with Win earlier, and there's some specific questions I'm going to ask him that I found to be very interesting, and I hope you find this interesting too. Win, you spoke about person-centric versus patient-centric care. Can you elaborate on the difference, and what does that mean to you?
Sure. Well, several years ago, I was working with a large system, and in conversations with providers, I realized that everyone agreed to patient-centered care, but they had very different understanding of what that meant. On one end of the spectrum, we had people who were patient advocates and who said, the patient is the locus of control, and they'd use a phrase like, nothing about me without me. On the other end of the spectrum, you would have providers who said, of course I'm patient-centered. We're going to do what's best for the patient, and I know what that is. Healthcare is complicated, and we have to decide what's best for the patients. And so it was a very paternalistic understanding of patient-centered care. So to help move people more towards a patient locus of control understanding, we changed the conversation to person-centered. And linguistically, you can think about patient. They don't exist without a provider. They're defined by their relationship with a provider. On the other hand, person is an independent entity with their own values and preferences and needs. And so they don't need a provider to exist. They have their own autonomy. And so by changing that conversation, we were able to, through education, through webinars, conferences, able to help people shift their understanding to a more person-centered approach that really says, we can't decide independently what's best for people. We need their input.
I totally get that. And speaking to Dr. Meter before this interview last week, he strongly suggested that, exactly that. And how many times do we speak to people or speak in a meeting or speak to your loved ones, and you already know what you're going to say next before you even have a chance to even listen to what the other person's saying? And we need to really stop and listen to what the patient's saying in order to make the right diagnosis and to connect. Thank you for that. Yeah. So the second question I have is, you speak about emotional intelligence. First of all, define that, and why is that so important for physicians to lead?
Well, this is not an official definition, but my working definition of emotional intelligence is, first is self-awareness, to be aware of your own emotions, and then to also be able to read other people's emotions and then modulate your interactions accordingly. And the reason that's so important is in a team-based delivery model, if you're not aware of how others are perceiving you, and if you're not aware of their emotions and their responses, it's going to be very hard to work as a team. I think that in healthcare, in medical culture, that's not something that's been emphasized a lot. We're used to giving, quote, physician orders, and people don't respond well to orders.
No.
And so it is very helpful. It makes us more effective leaders.
I see. That's so true. The top-down approaches doesn't really work in corporate healthcare these days, or in social situations, period. So why is, the other thing is, when we always talk about, physicians needing to learn leadership skills in order to be understood, in order to make a difference in healthcare. But then there's also the other side of healthcare administrators need to understand the value of having physicians on board. What would you say is the importance of why healthcare administrators need to incorporate physician leaders into the senior leadership boards when they're making decisions?
Well, I've seen a number of studies that correlate physician leadership with improved outcomes clinically and also financially. So it definitely improves outcomes. The other thing is again, because we talked about how this is not emphasized in physician training and culture, sometimes if you see a physician who you think has potential, you may need to invest and help them take some additional training or some courses or something to help them in that area. And it's definitely a worthwhile investment.
Right, right. And what would you say for the business leaders? Would they need any additional training?
Well,
It could be a sticky
sometimes,
subject.
sometimes, but I would say in general, I've observed, because there is more of a team-based approach in business, that
Okay,
generally that skill set is more prevalent. But
okay,
yes, there are exceptions.
right. And would you agree, and this is maybe going a little bit off topic, that, we're seeing in this day and age with PPEs and the issues with the ventilators in the beginning, and there was a lot of finger pointing going on about you versus them, and they did this, and the other group saying, well, no, they did that. And is that going to be, to me, that's not leadership. I don't know what you thought about that.
Yeah, that's really kind of finger pointing, and it's also kind of a win-lose mentality. What I've learned through my master's in negotiation dispute resolution is you really need to find what are the things you can build on. What's the common ground, and how can you find positive things to build on collectively, as opposed to finding fault and pointing fingers.
Yeah, I love that. Why did you even get your master's in negotiation dispute resolution?
Well, at the time, I was working with a large system in medical operations, and uh, probably 80% of my time was spent fire jumping. I deal with disruptive physicians and contract breakdowns and difficult conversations. And I thought, wouldn't it be nice to actually have formal training in this area? And
Did
a
that
saying,
did that help you a lot?
it did. It did, not only in medical circles, but in general life. And the saying that African saying that I've adopted is, when elephants fight, the grass suffers. And in the context of healthcare, I take that to mean that when providers can't resolve their conflicts, the collateral damage is with patients. And unfortunately, there's a lot of infighting and a lot of people trying to win battles, and the patients suffer because of that.
Right, right. Can you recall any specific stories of a conflict that you've had to deal with, or an example that you can tell us that you've learned to deal with easily because of your master's and your expertise?
Well, a small rural community in uh, Midwestern U.S. Had ER coverage from a couple of doctors, and for years it had been okay. And then they had a falling out between each other, and they just couldn't, because of their falling out, the ER coverage for the facility was in jeopardy. And basically I was brought in and helped them think of it not as a win-lose situation, but really what did they both need out of it? And as a result of that, the contract was, they could salvage it, and the ER coverage was then no longer in jeopardy.
That's that's amazing, really good. And I want to end this interview. We can go on and learn from so much from you. What would you say is the single most important thing for physicians to learn in being great leaders?
Listen to what other people are saying, kind of not only with their words, but with their bodies, and try to perceive what's going on with that individual. And then if you're in a conflict, the opposing party is not the enemy. Try to find what the common ground is and build on that.
That is awesome. Thank you so much for having this call with me.
My
And
pleasure.
if somebody has any questions, may they reach out to you, and how?
Yeah, I'll be glad to respond. Just reach out to me through LinkedIn.
Okay, great. Thank you so much, and I hope you stay safe, and hopefully maybe we can talk again and learn some more tips from you.
Thanks, Elsie.
All right, take care.